Thanks to Claire for inviting me to be part of this. We were at a conference recently, and she chatted and told me about this, and very excited to be part of it, and very excited to see all the people in the room today. I think it'll be some great conversation after the presentations. So I introduced myself earlier. I studied technology used across the life course and the impacts of that use, particularly in relation to health and well-being. And I want to talk to you a little bit about some of that today. I didn't focus really on my research, but I focused on some topics that I think will be interesting to several of you, and maybe we'll form some collaborations after today's meeting. So as Claire alluded to, we know that as people age, depression, isolation, social isolation, I can't talk today, isolation, loneliness tend to increase among older adults. Physical limitations increase, cognitive limitations also increase as people age, and that's very problematic, particularly when you look at the stats that show that over 40% of those age 65 and older have some type of disability, and 30% of individuals 65 and older have live alone. And particularly when you combine these to look at comorbidities, it's even more drastic, and potentially some negative outcomes occur in even greater numbers. So what I want to ask you to think about today is there a role for technology that could potentially help to mediate some of these negative outcomes as people age? As I said, I study technology use across the life course, from the very young to the very old, and trying to think about ways to use technology to improve people's lives. Unfortunately, or fortunately, older adults are going online more than they have in prior decades, but only 59% of them currently report using the internet. So we've still got over a 40% gap in terms of internet usage among older adults in the U.S. If you look at the type of devices that they use, you can see, compared to other age groups, they're much lower on all of those devices, except for e-readers, which are more popular for older adults in general. But computers, tablets are actually having quite a surgence these days, as they're much easier for many older adults to use. So if we think about the potential types of technologies, just in terms of the everyday ones that we see and we use, we still see that there are some gaps. And we have to think about what's accessible and what's usable for older adults, that we can actually think about doing some interventions to aid their quality of life. Now, some of my own research looking at retired older adults in the United States has shown that simply getting older adults to use the internet on a regular basis results in a 33% reduction in depression classification. That's quite dramatic when you think about older adults are one of the highest levels of depression across the life course. So if we can get them online and get them to do things that will help them to stay connected to their loved ones, to find information that can help them make important life decisions, like health information decisions, that can help them find the resources that they need and stay connected to their loved ones, it could be potentially quite successful in improving quality of life for older adults. So I want to talk about technology's potential in terms of doing some of these things. If we're going to help older adults to get online and to use technology, we've got to have much simpler interfaces. Just finished a big 5-year randomized controlled trial where we're using big laptops that, if it had been done a couple years later when the touch base and the tablets were more popular, it could have been so much easier for older adults to learn how to use these technologies. Luckily, interfaces are becoming more simple and easier for everyone to use. However, there's still some changes that need to occur into that. If older adults are going to be successful in using the technologies and then the evolving technologies, there's going to be training and support. Much of my research has shown that while it's good to help people get across that digital divide, there has to be continued support to help them to be able to effectively utilize the technologies over time. Particularly for older adults with lower SES, cost is an issue. Devices are getting much cheaper, but they're not free by and large. If you think about all that data that we use on those phones that we carry around in our hips, how much does that cost you? For many older adults that are on a fixed income, it's not an option for them. So, if we can deal with some of these issues, maybe we can continue to see increased access and usability among older adults, which will hopefully help increase connectivity and enhanced well-being. Now, I want to mention one other thing quickly, the Internet of Things. How many people have heard of this concept? A few people, okay. So the Internet of Things is about all these devices, these Internet-enabled devices that we are using in our society, and ways to connect those devices so that it can make for a better quality of life, in this instance, for older adults. So, for example, if you think about an older adult, and I'm talking fast because I'm out of time, an older adult who may have mobility problems, wouldn't it be great if there was a camera that could show them who was knocking at their door or ringing their doorbell? And wouldn't it be great if there was some device or button that they could click that would unlock the door from where they're sitting in their chair in a different room? That could notify them if they left the stove on. That could notify caregivers if they didn't get out of bed that day. The Internet of Things is about connecting all these Internet-enabled devices, which they're proliferating on a daily basis, to make our lives better. I think older adults are one of the areas that we need to really focus on in terms of the Internet of Things to enhance quality of life for older adults. So, real quickly, robots are increasing. We've got the smart homes that are increasingly coming across the United States. I've talked about the Internet of Things, particularly for healthcare. You think about older adults that see multiple care providers with different electronic health records. It's a huge issue to keep track of all this. I haven't talked about this, but cyber security is a big deal as we're getting more and more people online, particularly older adults. As someone, my own department, at least 12 people got their social security numbers hacked this year. Over 20 people in the College of Common Arts alone this year. We cannot file our taxes electronically anymore because our social security numbers have been hacked. This is a big deal. And for older adults who are not as tech savvy, it's a very big deal. So we need to think about interventions that can incorporate the things that I've talked about, and I'm sorry I'm out of time, but the future, we need to be involved in both creating the things that will help older adults in terms of technologies, but also in determining the impacts of those uses for older adults. Thank you.